Currently, I'm doing a degree in healthcare management, and something that I learned today, which I think probably hardly anyone knows, is that since 1988, the bed numbers, so the amount of beds, hospital beds, that we have available in the NHS has halved. So since 1988, we have lost 50% of our hospital beds to today, when you think about the growing population. Now, the research around it is they felt that most of those beds were utilised by people with mental health issues and learning disabilities, and they wanted to encourage more support at home, which I completely get and understand that we don't want to institutionalise these chronic needs when actually they should have better care at home. So I do understand that the funding would have been redistributed. But in reality, if we think about the growing population, that 50% reduction is insane. Like in our particular hospital, the population that we're serving is humongous. And you think about how little beds we have to how many hundreds of thousands of patients access our hospital, and then to have only a couple of hundred beds available. The math does not work in that scenario. And we talk about corridor care. Of course, we're going to have corridor care if we do not have the beds. You can try and encourage community care, more support with the GP, better emergency services. None of that will make it scratch if we don't actually provide the amount of beds to support the population, particularly when we think about an ageing population. So, yeah, I do think that the acute trusts are raising all of this. I think the national team are just, because it costs, and I understand costs, it has to come from somewhere, and already the majority of our taxes are going to supporting health and social care. I understand that, but we also have to be measuring up safety, patient safety, and delivering the standard of care that people expect. So, yeah, there we go. Learned something new today.